I'm Jerry Hesch, a physical therapist from Hesch Institute in Aurora, Colorado, and I specialize in orthopedic manual physical therapy, which means I treat joints in the body. And I treat them very, very gently, and I've developed many of these techniques of treatment. And Gina has had a MRI because of sciatica symptoms, but the MRI was completely normal. And she's had extensive treatment, but has not been able to resolve what she perceives as a twisted pelvis and has not been able to reduce the sciatica. And it's impacted her significantly in that she's only able to work with difficulty 2 hours a day. And her work does involve sitting, but even standing is bothersome, isn't it?
Yes.
You need to frequently change your position. So on the pain drawing here, you can see that she does draw in the region of the left sacroiliac joint and SI joint area on both sides, low back area, down into the posterior thigh, and also in the foot and ankle area. And regardless of diagnosis, I always evaluate the whole body because we don't know how things are connected. And what I found in evaluating her was that the top of the fibula was stuck posteriorly. So let's go out in the hall and let's film the skeleton and I'll show the top of the fibula bone. So the two lower leg bones comprise of the tibia, the big one, and also the fibula. And what I found was that all ankle, all foot, and subtalar joint motions were normal, and the motion of the lower fibula was normal, but the back of the fibula was rotated backwards, and it was stuck when I would try to spring it forward, and it was distinctly more prominent posteriorly. The other thing we found was that in her sacrum, the sacrum was twisted to the right, in which the right lower quadrant of the sacrum was prominent, and it was also stuck in terms of springing. And the other pattern we found was up in the upper cervical spine, where we tested upper cervical traction in neutral and with her head in 10 degrees of flexion and 10 degrees of extension, and she was hypomobile. I could not induce traction mobility there. And what we found out through treatment was that this pattern in the upper cervical was driven by a reflex. And direct treatment of that was not necessary because when we corrected the rotation of the left fibula, which was to the left, and the right rotation of the sacrum, the upper cervical spine just relaxed. And then I could easily induce traction in those three positions. And if we think about it and analyze it a little bit deeper, the left posterior fibula caused her body to twist to the left, the lower body. But the right rotation of the sacrum caused the lower body to twist to the right. So there was a reduction of rotational mobility in the lower body from both of those injuries. And that reduced rotational mobility up at the C1 vertebrae. And the C1 vertebrae rotates to the right 45 degrees and it rotates left 45 degrees. And treating that C1 vertebrae would have not been successful. It would not have restored normal motion there because that motion restriction was driven by a reflex. And while her diagnosis was sacroiliac joint dysfunction, I had to look down to the upper joint of the ankle. They call it the top ankle joint. And I had to treat that joint to restore normal rotational mobility in the lower body along with treating the sacrum. And my whole drive is to evaluate the whole body, not to evaluate based on a diagnosis. So her diagnosis was left sciatica of unknown origin. Piriformis was fine. MRI was clean. And so if I had only focused on treating the sacroiliac joint, I would have missed the fact that this was contributory to her problem, and I would have missed the opportunity to get the upper cervical spine to relax. So the drive home message that I've been pounding away forever, raising up the freak flag, is whole body evaluation is treatment is many times superior than just focusing on a single diagnosis such as sacroiliac joint dysfunction. And in walking, Gina feels like her left leg is much freer. Anything else you want to add to that?
I don't think so, not right now.
Okay, so after you walked up and down, you felt
Right.
like the left leg.
Absolutely, it was just a completely different feel for walking than I had been sort of struggling with, and something has not seemed right with my walking, and so I've had to like figure out how to do it.
Yeah, and they've been trying to address
They
that,
have been
but not
trying to
successfully.
but no one has looked at that leg. Despite
So-
the fact that, it was broken and got no physical therapy for it after the break.
Yeah. And you did have a fracture there, so
I
you
did
had a
have a-
large force go through that.
Yes,
You had
yeah.
a tibial plateau. The top of the tibia had a fracture.
Right,
So we have some history as to what might have caused that fibula to get stuck
Right.
posteriorly.
Right.
But it's interesting that no one then went on to evaluate the mobility of that
Nope.
joint that's nearby. It's not the knee joint, it's below the knee joint.
right. And that area has always felt nervy, and that there is
You
something
used
wrong
that
there.
term. When I was palpating it and spring
Right. Mm-hmm.
testing it, you said it was nervy.
Right.
Did you notice any change in that nervy sensation?
No, but while I was laying with the foam underneath it, I could feel sensations up and down the whole leg.
Is that right?
So I don't know if it's letting go,
Interesting.
or,
Interesting.
But
did it feel therapeutic, or did it feel like it was? It didn't feel like it was worsening things.
No, it was not worsening things.
Yeah.
But a trigger points up and down that leg
Uh-huh.
for a long time.
Yes.
So that was connecting to lots of places. That stuck
Oh,
area.
interesting. Well, I'm very encouraged by that sensation. I take it as a very positive effect, and hopefully will make a difference in your presentation, because I know it's been a couple of years now.
11 years.
11 years. So
11
you've seen
years,
an awful lot of
A
different
lot of-
practitioners.
different kinds of treatment.
Yeah. Well, thanks for letting
You're
us film
welcome.
this. I think it's
You're
an
welcome.
interesting case where lower body rotation affects reflex reduction of mobility in the upper cervical spine. And it emphasizes the need for a whole body approach to evaluation and treatment. Thanks.
Yeah, you're welcome.